So learning from tobacco control to address obesity, lessons from the Wild West. Now let's see if this does, oh, yeah, we have to go back. So you've probably seen some of the news, obesity, the new tobacco. This was a news headline almost 2 years ago now. You know, Peter Mansbridge even talking about obesity as a disease burden is worse than smoking, all related to the fact that obesity rates are going up, tobacco rates are going down, and so now the health issues, the burden is actually higher. Let's see if I can actually use the pointer. For obesity than it is for tobacco. So we are at a crisis point. It's time to do something about it. Now, this is not a new idea, however. Back in 2005, so 7 years ago, there was a publication called Improving Diet and Physical Activity, Lessons Learned from Tobacco in the British Medical Journal. And some of the lessons are probably going to be quite obvious, but hopefully you can think about these as we go through. First of all, evidence of harm is necessary but not sufficient to motivate policy change. And when I think to about 10 years ago, when I started working very intensely in the obesity area, all we wanted to do was tell people that obesity was bad, that it was going to increase our chronic diseases, you know, all of that type of thing. But it's necessary, but it's not enough. Secondly, and I think this is where I spend most of my time, and we'll emphasize Richard's points made this really well, we have to address the individual responsibility versus the collective environmental action early. Let's look at how the environment has contributed to the problem. Thirdly, and this is, I think, where we always have a lot of debate, is the idea that comprehensive packages of measures have greater impact. And I think it's very quick, people are very quick to say, oh, just taking the soft drink machines out of schools are not going to solve the obesity epidemic. Well, no one said they would. But it's part of creating a culture where soft drinks are denormalized, and that, in addition to things like taxing and restricting advertising and such, collectively is more likely to make a contribution. And then fourthly, rules of engagement with industry are different but needs consideration. We do all need to eat. Food industry is there and does create healthy foods as well as unhealthy ones. So we do have to work a little differently than we did with tobacco. That's one area where I'm still struggling, but it's also really interesting to note that the author of this article, Derek Yak, now works for PepsiCo, and perhaps one of his attempts is to work with industry through them. Okay, and then just again, reiterating some of the comments already brought up, back in 2006, along with Eleanor Wilson, we wrote a paper on obesity prevention policy recommendations for environmental change. And we said back then, obesity prevention should take a multi-sector approach similar to that used for tobacco control. Preventive efforts should invest in and target all age groups. And we need to research the effectiveness of our interventions as we go along. So why focus on policy? Policy is viewed as a powerful tool for behavior change. You've heard some of that already from Richard. And the World Health Organization, as much as 12 years ago, said the public policy environment is frequently cited as a critical location for solutions to the obesity epidemic. And we have lots of wonderful experiences from the tobacco control community in Canada that we can build on. So, what I want to talk to you about is what we have been doing in Alberta since, officially since 2008, funded through a population health innovative intervention by the Alberta Cancer Prevention Legacy Fund. And basically, we had 2 years to develop an innovative intervention, interestingly. And what we proposed to do in this project was to build on the successes of tobacco control, to look at integrating multi-level comprehensive interventions, policy interventions, and emphasize that population-level social change, and to expand the policy scope beyond tobacco. We didn't give up tobacco because one of our members, Les Hagen from Action on Smoking and Health, said tobacco's not done yet. So we kept tobacco on our agenda. We also included alcohol on our agenda, recognizing alcohol's contribution to chronic diseases. But the focus that I'm going to obviously present on today is obesity and the unhealthy diet and physical inactivity. Who are we? The Alberta Policy Coalition for Chronic Disease Prevention, a multi-sectoral interdisciplinary team that works together to coordinate efforts, to generate evidence, to broker knowledge, and advocate for policy change to reduce chronic disease. We initially, through our first 2 years of funding as a research project, were a project team with 2 advisory bodies, both an international advisory board and a provincial advisory committee. And we represented practitioners, policymakers, researchers, and community organizations. Since the end of the research funding, we have now become sustainable. We have 14 organizational members who all contribute to the work, and groups like the Alberta Centre for Active Living, Alberta Public Health Association, Ever Active Schools, Heart and Stroke Foundation, Growing Food Security in Alberta, and such. So how do we contribute to healthy public policy in Alberta? Well, our research really helped to form the foundation for some of this work. So one of the first things we did is we used knowledge, attitude, and belief surveys of policy makers, decision makers in Alberta to find out what the appetite was for policy change across all 4 of our risk factors. And I'm going to focus on the physical activity and the obesity and food-related policies today. So we did this at the beginning of the Policy Coalition funding and at the end, so 2009, 2011. And basically it helped us to identify where we might want to start. What is the readiness for change, and what are our priorities for advocacy? And we also did repeat a subset of this of the general population to get an idea of where there was public support for some of these initiatives. What I think for me was the most revealing finding was, we're talking about Alberta, okay? Now, just in case you haven't heard, it's kind of a conservative province. So it's had a conservative government for more than 40 years. So we're not talking about, California here. So anyway, one of the things that we did is we asked, do you believe that whatever behavior it is, alcohol, tobacco, obesity, physical activity, or eating, is a personal responsibility or a societal responsibility? And interestingly enough, okay, obviously these, if you add societal and personal together, it's more than 100%. So some people see it as a combination, and that's okay. That is okay. But what I thought was most amazing is that here is tobacco, and we've had a lot of success in Alberta in tobacco. And let me see, what are we looking at here? About 30% of our respondents thought that tobacco was a societal responsibility, and 90% still think it's individual. But yet, there's still momentum for change. So we can't just say, oh, people think it is a personal responsibility, so we have no room to act. We can still act even if people think that there are personal responsibilities. But what was most amazing to me is I looked at this compared to obesity. And when it comes to obesity, people see obesity as more of a societal responsibility than tobacco. That, to me, was extremely exciting and really opened up possibilities for us to move in the the obesity field. Okay, so I'm going to rush through some slides very quickly just to give you a flavor of some of these results. And just so you know, in all of these slides, the blue is indicated strongly support, the red is somewhat support, so altogether we have the support. These are the questions that we asked. Look at the top bar, which is just a compilation of all of the people that we surveyed. We did have people from workplace, from school, and from government that were invited to respond. So I'll just look at the top. But, providing education materials about healthy behaviors. Well, surprise, surprise, almost 100% of people were supportive of that. I'm actually surprised that not 100% of people were supportive of that. But, so the very traditional thing of providing information is highly supported in Alberta. Well, let's get a little more controversial here. What about restricting sugar-sweetened drinks and unhealthy food from vending machines in schools and public buildings? And yes, I know it's a complex question, and we did cut it into about 4 in our repeat survey. But what we're looking at, which I was very encouraged by, is we're talking about almost 80% of the Albertan decision makers are supportive of that type of policy arrangement. And part of that might be fueled by the fact that there was some voluntary removal of soft drink machines in elementary schools, and the sky didn't fall, right? So that's encouraging. What about prohibiting advertising of unhealthy food and beverages to children? Well, still support, but not quite as much. We're talking about just under 70% support for prohibiting advertising. What about implementing transportation policies to promote physical activity, things like bike lanes, lighting? Again, we're looking at almost 80% support for that type of change. Well, just so you know that this wasn't a sample who was just answering yes to everything that we said. When we asked about zoning bylaws to restrict the number of fast food restaurants in certain areas, not a lot of support for that, about 30%. So interestingly, though, that there is some support. When it came to the financial side of things, we asked two questions. One is, would you be supportive of taxes, and would you be supportive of subsidies? And I think what was surprising to me, this is tobacco. There's still support for more tobacco taxes, which is good. And there's support for subsidizing, things like nicotine patches and such. In terms of food, there's support for increasing taxes there, less so for subsidies, and that kind of surprised me a little bit until I was thinking, okay, we're asking government decision makers, taxes, they get money, subsidies cost money, so that's probably part of it, because when we actually surveyed the population, they were more supportive of the subsidies. So in terms of the conclusions and implications just from this type of survey, in our conservative Canadian province, decision makers are supportive of policy approaches that address healthy eating, physical activity, and obesity. Of course, not surprisingly, individually focused policy approaches achieved almost universal support. There was support, however, for environmental changes, less support in the actual financial type of economic policies. And then, as I mentioned, obesity is perceived as a societal responsibility even more strongly than tobacco, and I thought that was incredibly encouraging. So, how am I doing? I'm doing fine. So, in addition to doing that baseline survey, we also work with law schools, and we engage the partnership of the Health Law Institute at the University of Alberta, and had the lawyers there help us to do a review of existing legal instruments, things like legislation, regulation. You try saying that back to back. It's kind of a tongue twister. Policy initiatives and such. So we had our legal experts help us at looking where our possibilities were. And the other thing that we wanted to do was to facilitate knowledge sharing and evidence generation. So we started looking at media and how is obesity, healthy eating, physical activity framed in the media, that whole idea of issue framing, which I know is a big thing from tobacco control, so that we could think about how to move our advocacy forward. We have been hosting knowledge sharing events. We had a consensus conference in association with the obesity summit in Montreal last April. Yes, Manny, the paper is still sitting on my desk, but it's coming. We've had workshops on the built environment. We developed a website, and we developed a policy readiness tool. I'll just show you a little bit of that. This is a publication in the Canadian Medical Association Journal a couple of years back now that came out of our work with the Health Law Institute, Nola Rees and Barb von Tiggerstrom, Roadblocks to Laws for Healthy Eating and Activity. And they highlighted the idea that there is likely to be jurisdictional wrangling. Is this a provincial issue? Is this a city issue? A municipal issue? Is this a federal issue? These are things that are going to stall policy changes. The idea that there's just ideological opposition as opposed to evidence opposition. All of these things are going to stall legislation. There's also the question of effectiveness. People will often say, we don't know if that's going to be effective. Well, you don't know if it's effective until you've tried and evaluated it. So that's where we're really encouraging taking the piece-by-piece development of a comprehensive approach and not using the questions of effectiveness of the individual pieces as an excuse not to do anything. We can't just not do anything. We have to do something. Okay, this is our website if you're interested in taking a look. And the policy readiness tool just released in December. This really, Candace took the lead on developing this. What we did is we actually worked with municipalities to talk to them about types of policies that they have actually implemented in the past. It may be things like smoking bylaws, it may be things like pesticide use. And we were able to categorize policy municipalities according to whether or not they were an innovator, if you think, Rogers Diffusion of Innovations, or whether they were part of the majority or whether they were a laggard. And then what we did in the policy readiness tool was develop key strategies. So if you're working with an organization who's really a laggard, maybe you don't want to work with that organization first. You start with the leaders and then you work with the majority. So it really helps you to target your efforts. So I want to sort of summarize, and well, I have a little bit more than just a summary, but I wanted to bring to your attention this article, which I think was, it's quite compelling, also a little controversial, but I have to admit I learned a lot from it. It's published by Kelly Brownell and Ken Warner in the U.S. Kelly Brownell is an obesity researcher for many years at Yale University and now has the Rudd Center there. Published back in 2009, but it's the perils of ignoring history. And they talk about tobacco industry playbook. And is there a similar playbook for the food industry? And these are the pieces of the playbook. And I just want to use this to illustrate a few ideas about how this may indeed be happening without us even really paying close attention to it. Their idea that food industry emphasizes physical activity over diet. And just think about commercials for some of our food products. So go ahead, you deserve it. You work out, have a treat, you deserve it, right? The focus on personal responsibility, you can choose, right? Raising fears that government action usurps personal freedom, okay? If we allow government to come in here and put restrictions on this, where is it going to go next? We're going to lose our freedoms. That's that kind of thing. Characterize critics as the food police and accuse them of desiring to strip people of their civil liberties. I was named about 3 years ago to the Health Taliban, and I have to say I'm quite proud of that. Criticize studies that hurt industry as junk science. State that there are no good or bad foods, hence no food or food type should be targeted. And I have to say that, even I'm a dietitian by training, and one of the areas I even struggle with this is that, there are bad foods. There are no nutritional value in soft drinks whatsoever. So why do we say everything can fit in moderation? It's not the right message in this kind of context. Just in terms of the physical activity side of things, this is a recent publication that basically said in our today's highly mechanized sedentary society, in order to prevent weight gain, the average adult needs to exercise an hour a day. To lose weight, 2 hours a day. So the idea of using exercise is not going to really solve our obesity problem. We have to control the intake side of things. This is from a presentation I saw at a cancer control conference in Australia, and I thought it was actually quite brilliant. I put it up here, the Tim Tam, because it's an Australian cookie, which are really delicious, and I could eat a whole package. But in what they've done is what they're proposing is that they actually put on the label, instead of how many calories are in it, because people don't know what a calorie is, putting what the equivalent walking time is. 24 minutes to burn off one of those cookies. Like I say, I could eat a pack, and that's 13. Big Mac would be 2 hours, and a Mars bar would be an hour. Most people don't think about that when they overcompensate for their 20 minutes on the treadmill. What about the idea of government action usurping freedom? And this is a slide that illustrates the percentage of money that's put into nutrition education to counteract marketing of food. So this is a UK slide from the International Obesity Task Force, but in 2003, the total advertising spent on all types of food, soft drinks, and chain restaurants was £743 million in the UK. The same year, well no, actually the next year, so inflation, £7 million were spent by the government on nutrition education. What that means is that every 3 days, industry invests in marketing what the government spends in a year. So is this government trying to usurp our personal freedom? Would taxing sugar-sweetened beverages restrict freedom to choose? What kind of choice does this child have? There is nothing healthy here. And when we look at the way that prices have changed, this is one of my graduate students, Sue Bueller, pulled this together. These are the prices of milk, skim, and homogenized for 1 liter going up since 1999 to December of 2009. Here's soft drinks. Gone up a little bit, but not nearly as much. And that's for 2 liters. So, you know, if you want to choose, if you don't know where your next meal is coming from, it actually makes a logical sense for you to have pop. So what about the future of the policy coalition? We are exploring models of sustainability. Our current transition, in our current transition, Heart and Stroke Foundation stood up to the plate and actually funded our policy analyst for another year, and we're seeking ongoing funding from our other partners and then from future research. And I think one of the things that we decided as we were transitioning to the policy coalition that we are now is that what was missing from many of the organizations is advocacy. So there's many networks, there are many groups who are trying to work together to say the same message, but many of them are constrained by their inability to advocate for change. So we have decided to continue to keep advocacy as our key role because it is missing in most organizations and networks addressing obesity prevention. If you're looking for more information, here's all of the details on our website, our email. We are on Twitter. I have no idea how to do that, but if you do, you can start to follow us, and we're on Facebook, and you can like us. Thank you.